Hello, everybody. This is Gary. Today is April 13th, Thursday, 2023. It is 3:58 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. I didn't make a video yesterday. I do believe I made a video the day before that. Um, I haven't been keeping up with my daily schedule as much as I like to. My paranoia, depression, anxiety, auditory hallucinations have been pretty intense over the past couple of weeks, and I have not been keeping up with my exercise, my work, my videos, and my meditations. I'm seeing my psychiatrist tomorrow, so we will be discussing my increased paranoia, less motivation to do things, depression, anxiety, the auditory hallucinations intensifying. I don't know if we'll actually make any medication changes. I doubt we will. I'm already taking two antipsychotic medications, several medications for pain, a couple medications for anxiety, um, the Zyprexis for the voices and the paranoia. Um, but beyond that, I've been trying to, at the very least, uh, try to enjoy life as much as possible, whether or not I stick to my daily schedule. I do feel better when I have structure, and I do keep my daily schedule. Um, but I've been having a severe problem with lack of motivation to do things. It's more than just laziness. I think it's depression, negative symptoms. Negative symptoms of schizophrenia are when you have no emotional interest or enthusiasm for anything or motivation to do anything. Anything from something that might be really fun to something mundane like doing the laundry, or cleaning my apartment. Um, I just haven't had a lot of motivations to do things. I discussed these things with my therapist, who I saw on Monday, and she suggested I try to keep to my daily schedule as much as possible. The more routine I have, the better I'll feel, and the more I feel like I accomplished something. So I'm sorry about that. There's a motorcycle outside, and I have the window open. Um, but anyways, um, I'm seeing my psychiatrist tomorrow. We're going to discuss the increased paranoia, hallucinations, depression, anxiety. Insomnia, surprisingly, has not been much of a problem. Um, I do wake up sometimes in the middle of the night, but I usually am able to fall back to sleep. If I have to get up and go to the bathroom, I'm usually able to fall back to sleep. Insomnia has not been a real big problem. When insomnia does become a problem for days and weeks and months, that's when I'm more likely to end up in the psychiatric emergency room. But luckily for me, my medications seem to help me sleep okay. I take 600 milligrams of Seroquel at night, as well as 5 milligrams of Zyprexa and zero point 0.5 milligrams of Clonopin, with a bunch of my other medications as well. Um, but I'm seeing my primary care doctor, I believe, on the 24th or the 25th of April. Um, and we're going to follow up on the visit I had with the pulmonologist. We went over the fact that I do have pulmonary fibrosis in my lungs, but it doesn't seem to be that serious, and it's not something he's overly concerned about. The pulmonologist said it's something that we definitely want to keep an eye on, but it doesn't seem to be life threatening at this point in time. And there's no guarantee in the future that it will become life threatening. They did do a breathing test. A good basic score would have been 90%. I got up to 88%. My oxygen levels in my blood were about 94%, so that's normal. So I do have difficulty breathing from the pulmonary fibrosis. especially when I'm walking long distances or I happen to be carrying, I don't know, a heavy grocery bag. I get winded. Part of that's due to the fact that I'm overweight, but the other part of it is the pulmonary fibrosis, is scar tissue in the lungs, and it makes it more difficult to breathe. Um, so I definitely do get out of breath and more winded. And the pulmonary fibrosis is definitely there. It's real, but it's not life threatening at this stage, nor does it appear to be likely to become life threatening. Um, so I'm not as anxious over that as I was just a few weeks ago. Um, I did have another CT scan last Friday. I don't know if my pulmonologist has gotten the images yet or if he's looked at them. Um, but I was able to get into my medical chair online. They have a special portal for patients to look at their medical records online. And I don't understand all the technical jargon of a CT scan, but the impression that I got from reading about the scan without actually being able to look at it is that they didn't find anything that was immediately had to be taken care of right away. So I'm not as worried about the pulmonary fibrosis as I was before. Um, but that's all the report on right now. Like, comment, share, subscribe.